Have you ever been to Fiverr.com? You can type in logo design or anything, and different sellers will sell their services, trying to make a little side hustle. If you type in the word radiology, you will often find second opinions that are offered by radiologists, typically outside of the United States. So today I wanted to see a sample and send an MRI scan of a knee study that I had the radiology report here from the United States. And let's compare it to a radiologist here on Fiverr.com. So the first thing I did was to find a radiologist who says that she is a doctor in another country, and she will annotate images and assist you in radiology type settings. So purchasing the gig, I made a deal with her to read an MRI image, and she gave me a quote for $10. Of course, with a $2.55 Fiverr fee, it came out to be $12.55 for this reading. And just like a normal radiologist, she asked about patient information, asking about patient symptoms, stated the patient had an x-ray, I believe it showed a loose body, pain from a fall on ice, previous multiple surgeries, removing loose bodies when patient was around 14 years old, patient is now 27, and we suspect a questionable tear. So let's see what this radiologist on Fiverr.com for $10 would be able to find out. So I purchased the gig and sent the MRI scan to the radiologist, and I was told I would get a report back in 3 days. This report here is the one that is current from the States, from our radiologist, that goes into uh, pretty decent detail. We go to the menisci. It does show that there may be a fragment of a torn medial meniscus flipped into the intercondylar notch that was causing a lot of pain with this particular patient. Shows that there is a tear in the menisci horizontal at the level of the medial meniscal body near the superior surface. Ligaments and tendons and bone appear to be pretty normal. Also, for the articular soft tissue area, it does show some small joint effusion is present. Architectural distortion of the Hoffa's fat pad may be associated with prior arthroscopy, which he had multiple of those done. So the impression for the radiologist here in the States shows those in great detail. It does show the medial meniscus is abnormal. There's some signal body within the posterior horn, medial meniscus, just where the tear is. And there may be a fragment of the medial meniscal posterior horn deviated toward the intercondylar notch, but the visualization is limited. And this is the report I received for the $10 charge for the radiologist on Fiverr.com. It's definitely not in great detail as the other one is, but you probably can't expect much for $10. So I was pretty impressed. It did show most everything was normal. However, here it does show the medial meniscus. It does show the horizontal tear seam. The radiologist did pick that up. Previously, remember in my notes, it did say that a possible tear was suspected, but I did not say where. So this radiologist was able to pick that up. Also, everything is also normal until we get down here to the Hoffa's fat pad was unremarkable. It didn't say what the other radiologist had said, that there talks about the prior arthroscopy and the scarring suspected. But it did see the patellofemoral joint. It did say the defect is seen with the fluid and swelling. And the other radiologist did notate that there was a small joint effusion present. So everything was pretty on point with what our radiologist said, just not in great detail. And they did not notate the fragment of the medial meniscal posterior horn that was deviated toward the intercondylar notch. That was not mentioned on this report. So overall, I do think this was a fairly decent second read for $10. Not complaining here. Didn't have to pay a copay or out of pocket or see another provider. And these radiologists would have notated the films as far as annotating them and letting you know exactly what and where they see, as far as labeling anatomy and where they see the tears and those sort of things. So worth a shot. I just thought it was be a nice little video to show that the radiologists in the other countries are looking to make a little side hustle money as well, and $10 is not that much for a second read. Thank you for watching. Please like, comment, and subscribe. If you have any ideas for future videos, please let us know. Remember, always advance, never repeat.